afternoon and thanks for joining us. I'm Judy Simpson. Cancer and its treatment often come with significant challenges. In fact, treating cancer can require additional support beyond traditional medical approaches. If you or someone you know has a cancer diagnosis, then you'll want to hear what today's guests have to say. We have two medical professionals from the UVM Cancer Center, and they're here to discuss integrative oncology. I'm joined by Dr. Kim Dittis and Dr. Scott Parapato. They are both members of the Cancer Center and are both oncology specialists at the UVM Medical Center, and they've both been with us before, so welcome back to Across the Fence. Let's start with Dr. Dittis. What is integrative oncology?
So I think there are several terms that could be used for integrative oncology, and the way we think of them, this term is that these are the integrative therapies that help cancer patients with the side effects, dealing with cancer, dealing with the psychological impacts of cancer. And you can think of them as those complementary medicines such as acupuncture and massage and mindfulness and healthy eating. And they're very valuable in terms of helping to support cancer patients. But we like the term integrative because it heightens their importance, because we consider it a part of the treatment of cancer patients. And so is there a difference between integrative medicine and alternative medicine? Yeah, and the way I think about alternative medicine is that the word kind of defines the difference. Individuals who follow an alternative path often choose alternative therapies in place of traditional cancer therapy, and that's not how we think about complementary medicine or integrative therapies. Integrative therapies will not cure cancer, but they certainly will help with the side effects, decreasing the need for medications, and improve quality of life. And so you've started a program for cancer patients that really definitely falls onto this category of improving quality of life. Tell us about your Steps to Wellness program. Yeah, I think it's important to remember that exercise is an important part of integrative therapies as well. And Steps to Wellness is an oncology-based exercise program, excuse me, that allows cancer patients to exercise for free 2 days a week for 12 weeks. And what we really focus on is building strength and aerobic capacity so that people can get back to the same fitness level that they were prior to their cancer therapies. And that's really important too, because I would imagine that it helps you heal faster. It helps you heal faster, it decreases your fatigue, and just last week there was a report about the importance of muscle strength for breast cancer survivors. So exercise is absolutely critical. We also try to include healthy eating and nutrition pieces as well, because you can't run your way out of a poor diet. That's a good point. Let's bring in Dr. Parapato. I understand that you, along with your wife, have been impressed and really find this to be very important. As a matter of fact, you've put money toward this program.
Right. My wife, Tracy, who's a family doctor, we're osteopathic medical students, which always had a holistic approach. We were fortunate 30 years ago now with Dr. Herbert Benson at Harvard, who was one of the first mind-body schools, which is quite a school there now. And we were able to work with that where we were in Buffalo. And then coming here, meeting people like Dr. Dittis and others, and then getting a buy-in from the Dean of Nursing, Dean Patty Prelock, and Dr. Gary Stein from the Cancer Center. All of a sudden, we had all the pieces in place. So our family decided to make an investment in integrative care, because our belief is hands-on. Technology is great, but hands-on care is so important for healing.
And so how widely is this integrative oncology used, and does it fit with all cancer treatments?
Absolutely. In fact, works with all treatment, but certainly with the oncology and cancer treatments. And there's so many aspects of it, from the healthier person with yoga to hands-on massage and other care modalities.
Why do you think it works so well?
Well, I think it gets to the essence of the mind-body, get the spirit and the body together. We know nutrition and exercise, but certainly everything from, the mindfulness to the hands-on, whether it's Reiki care or healing touch, they really get the body in sync where it gets totally out of sync with our treatments.
Mm-hmm. And can both of you tell us a little bit about some of the specific types of medicine that we're talking about, and what the benefits, and maybe if there's a potential risk?
Yeah, sure. And I would like to add on to what Dr. Parapato was saying, is that many of these therapies will also allow the patient to take some control. It feels like when a patient is diagnosed with cancer, we take a lot of control away, and this is a way to give control back. And so the benefits vary a little bit from modality to modality, but there is a lot of evidence supporting use of acupuncture and massage and mindfulness for controlling things like nausea and for pain and dealing with the psychological impacts of cancer. And there's really minimal risk. Acupuncture can be associated with a little bit of bleeding sometimes, but the benefits so outweigh any of the risks.
And what do you hear from patients who start taking these steps?
Well, I really hear, what I hear harkens back to having them take control again. They feel better about themselves. They feel like they're relying less on other medications to help control their side effects. They feel that they are able to rebound faster after cancer therapy.
How about for family members? What do you hear from family members? And do they sort of take part in this too, as far as seeing, well, if my spouse is doing these things and feeling great, maybe I should start doing some of these things too?
Oh, absolutely. And staff, hospital staff that's under the pressures and, every day, that these modalities help them become more whole and better caregivers, and the family better family members.
Well, I would imagine, with the diagnosis of cancer, it's pretty overwhelming for folks and emotionally upsetting for folks. And so getting them back to the path of, one step at a time, getting stronger, getting better must be huge.
Yes.
It definitely is.
And so, Kim, are these resources covered by insurance?
They are not, as of yet, covered by insurance. Acupuncture is to some extent. But there is growing interest in covering acupuncture completely and adding in other therapies. And I think one of the things that's leading the way here, and I'm diverging a little bit from oncology, is pain. And so the University of Vermont Medical Center is really working on a comprehensive pain program and different ways of funding that will include these modalities. And I think that that's going to open doors for providing this for all patients.
Do you think everybody could benefit from something like this, and not just cancer patients?
Oh, absolutely. Everybody needs to exercise. Everybody needs to have a healthy diet. Mindfulness is important for everybody, and being able to move easily, and mobility, and what can be provided by massage and other and Reiki and other body therapies is beneficial for everybody. We should all be doing it.
And is it important too that these, if you talk about a yoga class, or you talk about some of the other classes that you were mentioning in your STEPS program, to get these patients together as a group, as a community, to talk about what they're going through? Does that help?
Yeah, what surprised me when we first started Steps to Wellness, the exercise program, I thought it was all about the exercise, because I'm an exerciser. But no, it was about the camaraderie that they developed, and they formed a group and actually continued to see each other even after the 12 weeks finished. So it's very much a supportive environment.
And so how can people find out about these services?
There is a website that has information about the therapies and how to get in touch with the providers of the therapies.
And tell me a little bit about how patients might go about accessing these services, Scott.
Sure. There's a central area that once you contact them, as well as the services are brought to them. So, for example, if patients are getting chemotherapy, there's the massage therapists and healing touch that actually come and offer it at many areas in the hospital, and we just hope to keep expanding that.
Are patients surprised about that?
Oh, absolutely. But word goes fast, because it's funny, I have people, one of my nurses, unfortunately, is just starting the journey with breast cancer treatment and healing, and she already has heard from people who are getting treatment that, oh, by the way, the massage therapist will come and this and get you through it. It's really good.
And are patients sort of open to this idea?
I think not only are they open to it, they are requesting it, almost demanding it. I think it's really important in terms of care in Vermont and across the country.
Why has it taken so long for this to become part of this treatment of cancer, do you think?
Oh,
I mean, it seems to make perfect sense.
No, it's a great question, and you know, it's almost you need a more mature health system. For example, if you go to Scandinavia, Europe, they're all built in, but they've been built in over decades. If you go, you know, Dr. Benson's influence in Boston, it's taken 40 years. One nice thing of our network and a lot of the younger providers, they've been exposed to it, so they're helping to bring it faster.
And I think that research has improved by leaps and bounds in terms of validating the effectiveness of these interventions, and the research is clearly there.
Right.
And now the healthcare system needs to catch up.
Tell us a little bit more about the Dragon Boat Festival, because I know this is going to be important for you folks going forward.
Yeah, the Dragon Boat Festival always raises money for cancer-related causes, and this year the money proceeds will go to integrative therapies within the Cancer Center, and so we're really excited about the Dragon Boat Festival.
Which happens every year on the waterfront, and it's huge.
Yeah, there are often over 60 boats. It's an all-day event. It's a great deal of fun, and it raises a lot of money for important cancer projects.
And as a matter of fact, you were mentioning the hospital has a team.
Yeah, we try to get as many as we can. Ironically, we got together as a urology team, and then again, our nurse Kathy is going through this journey, so now it becomes personal, so we're looking forward to it.
And once again, anybody can join a team or get a team together for this festival.
Absolutely.
And we can provide contact information from Dragon Heart Vermont to help people if they have some questions, or they can check out the website. The website has a lot of information about how to create a team.
Yeah.
And let's talk a little bit about, too, this integrative medicine idea and why it's so important to patients.
Well, I think the concept of integrating these therapies that we have known, that have known benefits into the treatments for cancer is huge, because they're additive and actually exponentially additive in terms of benefits for cancer patients. I think it's important not to forget that our current cancer therapies, chemotherapy and surgery and radiation, they save lives, but they do have some collateral damage, and by using integrative therapies, we can really mitigate that collateral damage and help people go through the journey and move beyond that in a lot better shape.
And so if people want to find out more about these particular therapies that are available, what should they do?
I would check out our website. There's a lot of information about the therapies and how to access them on the website.
And what would you have to say for patients?
I would say take advantage of all the opportunities, and what's fascinating is the fact that once you get through your treatment or your trauma, survivorship, and these help you get back into life, and it's amazing how many people continue these, you know, ideals going forward, because it just makes life better.
And is the fact that this isn't as mainstream as in other countries, the fact that as physicians you concentrate on getting people through this, curing the cancer or getting them back on their feet, but then what happens after that hasn't really been all that considered?
I think that the whole survivorship thing in terms of cancer has been considered. I mean, we have standards in terms of providing information about survivorship care documents and treatment going forward. I think that physicians get busy, and it's hard to keep everything in mind, but we're establishing a support system with people that aren't necessarily physicians to help keep us on track to provide patients with access to these services.
And you're right, it's lifestyle. You get sick, gives you a moment to pause, and perhaps a better life and lifestyle can come out of it.
We have about 30 seconds left. If we could put that integrative oncology resources slide still up again for folks to take a look at, because it's really important to know how to access that information. And it's right there on your screen, and you can see there's several different ways to get all kinds of information. And speaking of busy doctors, I want to thank you both for taking time to be on Across the Fence today.
You are so welcome.
Thank you.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.